assisted living waiver versus residential care facilities for the elderly in California. Two types of programs I'm going to discuss. Someone hired me to do the research and I'm going to share it here. What is the residential care facility for the elderly? This is sometimes called assisted living facility. It's 16 plus bed facility, or board and care, which is 4 to 6 bed facility. These are non-medical facilities that provide room, meal, housekeeping, supervision, storage, distributions of medications, and personal care assistance with basic activities of living such as hygiene, dressing, eating, and so on. All services for the residential care facility for the elderly are provided to people who are 60 years of age or older. This level of care and supervision is for people who are unable to live by themselves but do not require 24-hour care. How does a residential care facility for the elderly differ from assisted living facility? From licensing perspective, they say these are the same. There's no differences. Facilities describing themselves as assisted living and offering personal care and supervision are licensed as residential care facilities, period. Okay? Residential care facilities are dominated by smaller 6 to 15 bed, locally owned facilities with shared rooms. Larger facilities usually offer private apartments and tend to be corporately owned. Residential care facilities must meet the care and safety standards set by the state and are licensed and inspected by the Department of Social Services, Community Care Licensing, Senior Housing Complexes, Retirement Village, or retirement hotels that provide only housing. What are the staff requirements? Minimum training. Administrator must take 80 hours of certification programs, pass a state exam, and obtain 40 hours of continuing education every 2 years. Who pays for the residential care or assisted living? Most people pay privately for care. Medicare or Medical or Medicaid of California will not pay for these assisted living and residential care facilities. Okay? So what's the next thing? Next thing is something called assisted living waiver. That is home and community-based waiver that was created that directs the department, the California Department of Healthcare Services, to develop and implement a program to assist people pay for their group home with Medicaid benefits. Okay? The goals of the assisted living waiver is to facilitate safe and timely transition of Medicaid eligible seniors and people with disabilities from nursing facility to a community home-like setting in a residential care facility for the elderly. See, you are still at the residential care facility licensing, but now who's paying for it? Well, the waiver will pay for it. Okay? Also, adult residential care facilities or public housing could be used to pay for these services. Okay? So these programs, the waiver program will pay for it. Currently, it says the assisted living waiver is accepting applications from qualifying residential care facility for the elderly, adult residential care facility, and care coordinator agency and home health agency. Community care facility means a facility that's licensed by the department. Community Care Licensing Division, including but not limited to an adult daycare facility, social rehabilitation facility, or residential facility. Okay, I'm going to get straight to the payment because I found also the reimbursement rate. But just keep in mind, it's a community care facility, residential care facility, and adult daycare facility under these waiver programs. Okay, so the assisted living services provided in either residential care facility for the elderly, adult residential care facility, or in a public housing services serviced by a home health agency have 5 tiers of payment. Tier 1, $91 per day. Tier 2, $108 per day. Tier 3, $126 per day. And Tier 4, $171 per day. And finally, Tier 5, $257 per day. These tiers are level of care needed. The level of care needed for by the clients, and based on the level of care needed, you get paid a different amount per day. Okay, this does not include room and board. So these residents still have to rent the room and board from you, and that's usually paid with their Social Security money. Okay, so that is the program. I'm going to summarize it again. Residential care facility, assisted living facility are the 2 licenses. Not Medicaid is paid in many of them, and those who qualify for Medicaid, the waiver program pays for it. In not all the country, all the states, by the way, on only 15 counties. What are the 15 counties? I cannot say all of them here, but I included San Diego, San Francisco, San Bernardino, there's a lot of San Clair. All the big, large counties have these waiver programs. All right. Hope that's helpful for the person who hired me to do California, and that's hopefully that's what you were looking for. It's a good business.